Time to talk about the NHS. There was a government report leaked today that indicated that 6 years after Brexit there would be an NHS staff shortage of between 26,000 and 42,000 workers. And of course it indicates that Brexit has a major impact on that. Now it's starting to become clearer to the public that Brexit is actually bad for the NHS. This wasn't at all the case during the referendum debate, when of course matters of the NHS were dominated by that red bus with 350 million written on it, the vote leave flyers with NHS logos on it, and all the narrative about immigrants burdening our NHS. What was actually being said by professionals at the time, by experts, was that Brexit would be bad for the NHS. This was said by the British Medical Journal, the Lancet, the Royal College of Physicians, Royal College of Midwives, Chief Exec of the NHS, and over 70 former leaders of the Royal Colleges and British Medical Association. In fact, there was one poll done on NHS hospital leaders that found 75% of them thought that Brexit would be bad for the NHS, specifically staff hiring and research and innovation needed around the NHS. But this didn't get through to the public because it was blasted out of the way by the vote leave propaganda. So it is becoming clearer now the damage that is actually being done. So let's talk about the finances and let's talk about the staffing. In terms of finances, that 350 million is not going to be coming. There is going to be no Brexit windfall because the macroeconomics around Brexit are much larger than the 0.5% of UK spending that was a contribution to the EU. So that money didn't come in the autumn statement before, and it's not going to be coming in future. In terms of costs to the NHS, there is of course the NHS purchasing costs that have been exacerbated by a falling pound. So if you buy from abroad MRI machines or medical equipment of any kind, then the falling pound makes that more costly. The total cost, someone estimated at 900 million per annum, but that's tricky to calculate. Now on to staffing. We already know that since the Brexit vote, it's been harder to recruit doctors and nurses for the NHS or social care, and some of them have been leaving. It is not a case of saying, oh, we'll just allow them to stay, because they are not cattle, they are people. They make their own choices about where they want to live and work. And a falling pound and a more hostile environment, plus just general disagreement with the philosophical direction of the country, as well as less security for their own lives, means that it is much harder to get the staff from there. We cannot easily replace them with British staff because it takes a good 7 years to train up medical staff. So those are problems being faced right now by the NHS because of Brexit, or exacerbated by Brexit. Further down the line there is another threat, which is of course a US-UK trade deal. Now that would be led in strong part by US pharma and US healthcare companies looking at our 116 billion per annum NHS and wanting to have a crack at that. And that really is a threat for the NHS as we know it. So this awareness that Brexit is bad for the NHS is rising in the public, and I think it's going to become an important feature going forward.